Hello and welcome to an edition of eCW Podcast. We're coming to you live today from Nashville at the eCW National Conference 2023. My name is Brian Saul, I'm your host, and with me today is David Uptagrafft. He is the CIO as well as the Director of Patient or Healthcare Engagement at Innova Health. In Alabama. Thanks, David, for being with us today.
Thanks so much, Brian. It's great to be here.
And so we're going to talk a little bit today about touch and some different ways that your practice uses it in to help out along the way. My first, I guess, question would be, what is it that actually attracted you to touch?
Sure. Well, really, it's scalability of the operation. In terms of IT support, one of our distinctives at Innova is that we embrace new technology. eClinicalWorks is a huge part of why that can be a distinctive.
Good to hear.
So to have a sustainable approach, we already had our staff, all the staff, with a laptop. Even Triage and medical assistants would walk to the lobby and walk into the patient room with a laptop. The iPad is so much more usable using eClinicalTouch, so much more portable for those staff members to actually go and room the patient, et cetera. And that's really a huge distinctive of why we were pursuing it in the first place. That coupled with the fact that it was much more scalable as we expanded into multiple locations, that we were able to lower our IT costs of deploying laptops to everybody and the subsequent maintenance costs, because that is substantial as compared to an iPad.
Yeah, sure. The difference in price between a laptop and an iPad, as you said, is extremely substantial. So
the upfront and the continuing maintenance costs associated with virus checkers, updates, et cetera, et cetera, et cetera.
Yeah. Now, you use it in not a unique way, but well, I will say in a kind of a unique way. Tell us a little bit about how you actually go about utilizing touch in your office.
Certainly. So we really utilize it with what we call our guest triage assistants, which are the people that go out to the reception area, retrieve the patient, and room them back to the patient room. One of the things we like about that experience is we're trying to be personal. We're trying to be the opposite of the circle case sliding glass experience at the doctor's office.
Sure.
And walk up to the guest and say, hey, Mr. Smith, we're looking at their picture right there on the iPad. It's very obvious who's checked in, as opposed to having to navigate into the hub like you would within the traditional interface. So we walk up, we see them, we greet them in person versus yelling their name out from the window or from the door. And then we walk them back to the room and actually perform their triage, their blood pressure, their chief complaints, and document that in the iPad as part of that process. They also, of course, import the history that may have been put in on the kiosk when they checked in, so it integrates seamlessly with that experience. So the patient's already checked in on the kiosk. Now the triage assistant is importing that, if it's an AWV, getting their updated information in as part of the visit straight into the progress note. And then they hand off to the provider who does the visit in a traditional manner with a laptop. But at the end of that, another person comes in again with eClinicalTouch and actually completes the checkout and scheduling process in the room. So we do scheduling in the room on eClinicalTouch.
I think it's fascinating that you use it to get your patients out of the waiting room the way that you do, by not simply calling out a name and having them come in at that point. It's a very personalized, very HIPAA compliant way of approaching that. Now, I know also as well you brought a little bit of a prop with you today. I won't call it a prop. It's
so here it is in the flesh. I mean, in all of its glory, with a $20 online iPad case. In the past, we use OtterBox for these things, which is great if you're going kayaking with an iPad, but we're not needing that. So we really just use this basic enclosure. It's very inexpensive, and it's more than sufficient for, as you can see, the MAs just slip their hand in there. They walk out to the room. They know who they're looking for because everyone that's checked in is right there on the screen, and they're able to greet them, kind of like we heard earlier today, face to face,
right,
instead of yelling their name and wondering who's going to pop up.
Are there any thoughts about expanding the use among providers or other folks within the
Absolutely.
practice?
We cannot wait to see what version 4 has. We're still on version 3, so we're excited about 12.02 and being able to upgrade to the next version. We'd really like to push our guest receptionists to be using eClinicalTouch, because we already are using the kiosk for 95% of the check-ins. Unless there's an exception, they're going to check in on the kiosk. Her job is to be there to assist them with kiosk check-in.
Right.
So when there is an exception, we'd like for her to be able to handle that on eClinicalTouch as opposed to, again, having that laptop to walk around with.
You know, one thing I neglected to ask you at the very beginning of our discussion here, can you tell us a little bit about your practice?
Of course. So again, we are in Huntsville, Alabama, just a couple hours south here from Nashville, and we have 21 providers, 7 doctors, 14 nurse practitioners. We are a primary care practice, but we also provide urgent care as part of that. We're a patient-centered medical home, so we really strive to be available for our patients so that they don't need urgent care. We certainly don't want them to use the ER unless it's actually an emergency.
Sure.
And like I mentioned earlier, we really strive to practice individualized health care that serves through new technology and recognizes that each person is a distinct individual and serving them through a trusted relationship. So the eye contact, the exceptional customer service, and the effective technology, not technology for technology's sake, but technology where it allows us to deliver an increased customer experience and an increased healthcare outcome is what we seek.
Well, it definitely sounds like Touch is aiding you in that mission.
Absolutely it is.
No question about that. David, thank you so much for being with us today. It was a pleasure speaking with you. And folks, if you're interested in watching more eCW podcasts, you can find them on my.eclinicalworks.com, Apple Podcasts, YouTube, and now on Spotify. Again, David, thanks so much for coming by. And everybody, have a great day. Take care.